Tune in to NCN on Thursdays at 7 p.m. and the VOG on Fridays at 11 a.m. for the Ministry of Health's weekly program, Health Matters. This program seeks to educate you, the general public, on proper health-seeking behaviors while making you aware of the services available at the hospitals and various health facilities across the 10 administrative regions. You don't want to miss this. Tune in on Thursdays and Fridays. Be educated, be informed, because your health matters. Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health, where we try to educate you, our general public, on issues and various health issues. On our program today, we have got Dr. Tariq Jagnarain. He is the Program Manager of the National AIDS Program Secretariat. And also from the National AIDS Program Secretariat, we've got Dr. Freeman, Travis Freeman. He's the Prevention Coordinator. Gentlemen, welcome to our program. Dr. Jagnarain, I will go straight to you. World AIDS Day is coming up. End inequalities, end AIDS, end pandemics. And that's the theme. Are we in Ghana ready to end all of these?
Ready in the sense that we are putting steps in place to get there. Of course, we have a number of years. It is our vision to end HIV along with STIs as well by 2030. And this is something we've been working tirelessly to do over the past few years, and we're getting there slowly. We have a HIV prevalence of just around 1.4% in the population, and that has been constant throughout the years for the past 5 years. From our uncertified data we're seeing for this year so far, that would have dropped a little bit to 1.3%. So that in itself is good news and indicating we're heading down the right path.
What have been some of the achievements, and let your viewers know that you're still new on the job, even though it's rapidly coming to a year, and something which you have hit the ground running. But give us some of what's been happening over the past year.
So we definitely have been working tirelessly to better achieve not only control but elimination of this HIV STI pandemic, and some of the things we would have done as was guided and the vision of the Honorable Minister of Health to have PrEP, which is a pill that prevents you from getting HIV, to be rolled out and have it expanded at various sites in Guyana. And I'm happy to say that we would have done that, and it's now available at least 15 sites, not only public sites but also private facilities. We are in the process of starting our pilot for HIV Self Testing. A simple test like a pregnancy test that you can do at home to know your HIV status. We started embarking on several new strategies, such as the index testing. For every new positive case that you encounter, you can actually do somewhat mapping to see the partners persons would have been with over a given period and have them tested as well for HIV. We're going to be starting sometime in December our recency testing. This is a test that can tell you for every new HIV case if you would have acquired HIV within the last 6 months to a year. Not only that, I'm happy that we would have actually had our Hep B guidelines recently approved and start distributing throughout Guyana. So we not only test for Hep B, but we treat for Hep B. We're working on having our hepatitis C as well, the guidelines for those, as well as treatment available. Some of the challenges we would have faced in terms of having a distribution problem and shipping problem for ARVs, we would have worked tirelessly to address those. Having condoms and lubricants available, especially to the key population. And so we would have worked along with that. And at the same time, working with our CSOs and our private sector to get involved in the HIV program, because HIV no longer should be a problem that is on the shoulders of the Ministry of Health or the National AIDS Program, but we need the involvement of those civil society organizations, NGOs, even the faith-based organizations. We've started to engage them, not only speaking about stigma discrimination, but to have small talks and a little bit initiatives at their own religious facilities that can provide services for HIV.
That is quite some work there, no doubt hard work from you and your team. Dr. Travis Freeman, you've been in the fields. What is happening there as it relates to prevention, and what is doing in the, up there?
Thank you for the question, Nazim. So, for prevention, I must say the National AIDS Program Secretariat has adopted what we call a combined prevention strategy. And as it relates to combined prevention, it entails biomedicals, it entails behavioral changes. So, Dr. Jagnarank would have mentioned a few of some of those biomedicals, which include the provision of PrEP, the provision. And I must commend NAPS, Dr. Jagnarank, for making more STI testing available at the primary healthcare facility. This means that NAPS would have now taken on a community based approach where they've increased the accessibility to HIV services, testing services at the community level. So, as I said, our approach, our prevention approach, is a combined one where we've now have accessibility to the biomedical aspect, which is the condoms, testing, the PrEP pill, the HIV, the self testing kits available. But also, we've been addressing some of the behavioral issues as it relates to HIV, STI in Guyana. So, apart from HIV, STI sensitization and raising awareness, we are also working on behavioral change, having people behavior change as it relates to sex, as it relates to sexual transmitted infections.
Right.
And
So we'll
just
take a break.
uh-huh.
When we come back, we'll have more to discuss on health matters. So don't go away. We'll be right back. We were talking, Dr. Freeman, just before the break, and you did say that you're trying to the NAPS is trying to decentralize the services, including more testing sites, and no doubt, Dr. Jagaran did mention about the involvement of CSOs, civil society organizations. Tell us more about that.
Thank you, Nazim. So, as we were saying, we have CSOs, we have more facilities within the community that is more accessible to persons within the community. And apart from these services, are some of the behaviors that we are trying to change. And if we were to look at our World AIDS theme, end inequalities, end AIDS, and pandemics, one of the things we are trying to address is stigma and discrimination. And it's not only stigma and discrimination from the general populace, but from also from healthcare workers. So we want to ensure when someone comes to a health facility to access any service as it relates to HIV, STI, any service, there should be no stigma and discrimination. And yes, I'd like to applaud all of our CSOs who are working tirelessly with the NAPS and by extension the Ministry of Education to addressing some of these very challenges and assist NAPS as we address the unmet health needs of the general populace and also the key population.
Dr. Jagaran, you were talking about behavior change as forefront into the fight. How do we and will we be able to measure these behavior change?
I'm happy to tell you, and thank you for that question, Azim. I'm happy to tell you that the National AIDS Program is actually embarking on a national survey, referred to as the BBSS, a Behavioral Biological Surveillance Survey. This is a survey where we go to persons out there in key areas, and we try to evaluate their sexual practices in terms of their use of condom, their use of PrEP if it's available to them, having multiple partners, using sex toys. And you might be surprised because over the years, these numbers is what guides us to make specific interventions as well as interventions in targeted areas. And so look out for us. We're out there. We're coming. We're interviewing you. We're not only doing interviews, but we're providing testing.
Dr. Freeman, and this can be for both of you because I'm very much interested, and I'm quite sure our viewers and listeners will be much more interested about the two areas you mentioned in prevention, and that's the self-testing and the PrEP, and Dr. Jack Moran did allude to it. Dr. Freeman, I don't know if you can tell us a bit more details. How does this PrEP work, and who will really benefit from this?
Okay, so like Dr. Jagner, I would have mentioned, so PrEP is one of our newest innovation as it relates to HIV prevention. PrEP is the pre-exposure prophylaxis. Sorry, this is before you become exposed. You're taking a preventative measure. So this is a pill that we're going to provide and we are targeting discordant couples. And what this means is that one partner might be HIV negative, whereas another partner would be HIV positive. The partner that is HIV positive is going to continue their antiretroviral treatment. However, that partner that is negative, apart from the condom, now has the PrEP pill that would give them further protection. This also is a combination because we're still encouraging condom use. Remember, PrEP would prevent you from contracting HIV, but there are other STIs that you're susceptible to. So this is just another preventative tool to ensure that you remain negative.
And this is going to be rolled out, or is being rolled out across Guyana?
Yes, Nazim. So, like Dr. Jagner, I would have mentioned, we already started with about 15 facilities, and these are currently in Region 3, 4, and 6. But we do intend to roll out to the other regions because, like I said, NAPS is about making all of its services accessible within every community. So we are going to meet the unmet needs of all individuals in every community throughout Guyana.
Dr. Jagger, the one that's really intriguing me, these days we have moved forward now in all sorts of self-testing for our diabetes, our blood pressure, and so forth. And I never thought that I've seen we can able to do self-testing as it relates to HIV. For those viewers who might not be aware as to what that entails, if you can just tell us.
Just before I mention what it entails a bit, I just want to point out that most of the interventions that we make at the National AIDS Program, we're not reinventing the wheel in any way. These are all best practices that are done throughout the world, not just first world countries, but countries where there is high prevalence of HIV, such as some of the African countries, and they would have been seen to be very successful. And one of such activity is the HIV Self Testing. Like a simple pregnancy test, you're having an opportunity to do a HIV test at the comfort of your own home. But of course, it's not just having a test done. We're providing you with that counseling before. We're evaluating you. Are you someone who are at high risk of experiencing social issues as a result of whatever the test says? And at the same time, we provide you with post-counseling and link you towards a care and treatment facility. So when you come in, we tell you a little bit, we guide you, we show you through that process. And so we have two phases. You can actually do the test in a private room if you like. And so right there and then we can see the results and then we counsel you even further. Or after evaluating you, we realize, look, you're someone that you're going to follow up with us. You're going to come back. We can get in contact with you and talk you through the process. Then we can actually give you that test to take home, have that test done. And of course, we have a number you can call right away. We talk to you. We'll check in with you. And you know your results. Gone are the days when many persons had inaccessible approach towards getting a test done. But now you can have it at your own home. We have to try to offer differentiated services towards individuals and communities and adjust towards that to that setting.
All right. Dr. Freeman, you mentioned stigma discrimination as one of those barriers. What's NAPS been doing at your end to combat, for want of a better word, but to reduce the elements of stigma and discrimination, especially to what you would call in terms of key populations, those who are marginalized in our community, men who have sex with men, transgender, sex workers, and so forth?
I think Nazim, the biggest thing that NAPS is doing is educating. NAPS continuously educates the general population. It educates professionals who these our target population may come into contact with, and I think that's the most important thing NAPS continues to do is to educate the population on stigma and discrimination.
And if I may add to that, Nazim, while educating them too, we try to target a specific group of people who we know our key populations interact with. Our police officers, students in school, we have the magistrates, as well as healthcare workers, among others. And
Military too?
military as well is involved in that. We had several sessions with them. And not only in terms of educate, we were actually working on our stigma and discrimination policy that we have to have it adopted not only at workplace but various sites. And they're gone are the days when persons couldn't have, if you're HIV positive, you can't enter the military force, the police force, or have an insurance. These are areas we're working to have this policy to address so that we don't add to any stigma and discrimination. The National AIDS Program, it's in its goal as guided by the UN AIDS, we're aiming to reduce inequality, stigma, and discrimination towards these key population by less than 10%. And so we have some work to do around these areas. Lots of time it has to do with lack of knowledge. That's what contributes to this stigma and discrimination. So first we'll have to teach persons slowly about HIV.
This country is now receiving lots and lots of immigrants, mostly in Spanish. And I know from time to time, some of them access the service. So we have system put in place, language and so forth, to have interventions.
We do have, and so we're now considering the migrants as part of our key population as well. And we've been working with lots of the UN agencies like UNHCR, UNDP, among others. And we're providing care packages, which includes condoms, lubricants, testing, linkage into sites, and not only the testing and linkage to sites, but also we're provided it in the language that you speak. We're not only focusing on the Venezuelans, but there's also the Brazilians. We're targeting areas where you may have a high population of them. We have a lot of outreaches going towards them. At the end of the day, we need to show, look, we can actually take this under control and reach out to them too.
Joanne?
No, I just wanted to emphasize the points Dr. Jagnarai made, that even our package of services that we're offering at the community facilities, we have them
I saw a banner with both Spanish and English.
Yes,
in English.
and even the flow chart. So when they enter a facility or even from outside of the facility, there is messaging already in Spanish, there's messaging in Portuguese and in other languages.
What's interesting too, we're actually taking on a few of our staff in who speaks, they're either bilingual or have some level of understanding of the Spanish. I think it's one of the first time at the National AIDS Program we have so many people working that are bilingual.
Right. So what we'll do, we'll take another break, and when we come back, we'll have more for you on health matters. Dr. Freeman, persons living with HIV and AIDS really need to be having a good nutrition to continue living, also with medication. People are living longer lives now. You hardly hear deaths relating to HIV. How important for those viewers who are listening, those who are infected and affected, how important is nutrition?
It is one of the most crucial pillars in treatment and in taking care of yourself. If for someone living with HIV, Nazim, nutrition always lends itself to immunity. And so we always encourage, and even in our health education talks, even with our peer educators, I just want to take this time out to say that NAPS, now we have peer educators, not only from the general population, but peer key populations. And that's what we're working on. We're working on comprehensive sexual reproductive health. We're working on nutrition. And to elaborate a little more on nutrition, We're just encouraging persons who are on treatment to ensure that they have a balanced diet. It's nothing special. It's the same vegetables that you find in our markets. It's the same foods you find in our grocery store. The important thing is to ensure that you have a balanced diet.
Yeah, definitely. If I may add to that a bit, I mean, um, my principal occupation, not just as a policymaker and the program manager of NAPS, is I'm also an endocrinologist, and so one of the things we're trying to bring to towards person is how best they can adapt what they have within their own kitchens. That one is healthy, boost their immune system, and at the same time prevent other non-communicable disease such as the heart problems, the diabetes, hypertension. And so we have a food bank where we would give hampers towards persons who are vulnerable. Maybe they're not working, they're unemployed for whatever reason. And so we're trying to show them, we may give them menus, we may give them talks to show them, well, look, while it's cultural. We know this. Most of us, we love to eat rice and flour and everything. It's about rice and flour. But we can simply start moving towards more legume-based foods, peas, beans, lots of fruits and vegetables. And being HIV positive persons too, they're more susceptible to a lot of other illnesses. And so having a good immune system that is contributed as part of their diet is what makes them better equipped to fight off HIV.
The last two words in the theme for World AIDS Day is end pandemics, and we are going through one. That is why we are wearing this mask at the moment. That the conspiracy theorists have always been making an impact on the whole thing about HIV, which is been a pandemic or epidemic, and now that too is now being consumed by COVID-19. How safe is the vaccine as it relates to the HIV, the ARVs, the medication for persons living with HIV and AIDS? How safe is the vaccine, and should there be concern by persons living with HIV and AIDS?
Nazem, thank you so much for asking that question. And I think it's one of the biggest messages we want to bring out to the public out there, especially persons who are HIV positive, that numbers tell a story. Around the world, many persons, HIV and non-HIV, would have received these vaccines. Many research are out there, and it's showing clearly that the vaccine works. It not only prevents you from getting serious symptoms of the COVID-19 or dying, but at the same time, it boosts your immune system and even help you to fight off HIV. In no way there's any form of interaction with your drugs. The vaccine and the drugs do not interact. So those of you who are hesitant out there, come, get the vaccine. Even if you are, talk to us. We have had several programs where we go to persons, talk to them, provide individual counseling, and to get them on board to get the vaccine. And so we've seen a drastic uptake, I'm happy to say, in terms of our persons living with HIV. But those of you who are still hesitant, please reach out to us, get the vaccine. It is safe. Be vaccinated.
Doctors, thanks a lot for being on our program today as we talk about HIV and AIDS. Dr. Talik Jagnarein, the program manager, and Dr. Freeman, Travis Freeman, he's a prevention coordinator. The HIV/AIDS hotline is 223-7138 and 223-7139. You can search Facebook for the National AIDS Program Secretariat. You can call to ask questions, or you can message on the National AIDS Program Secretariat Facebook page, and they will try their best to answer your question. I'm Nazim Hussain. Thank you for watching another edition of Health Matters. Do join us again next time. Until that time, be safe.